Sounds good.
I have too many choices. What do I do? Do I eat butter and steak,
Mm-hmm.
or do I avoid all meat, or should I just be a pescatarian?
Mm-hmm.
You know what I mean?
Exactly.
Which direction do I go? And our
hard.
seed oil is going to sneak into my house at night and strangle me. It almost becomes this unhealthy obsession, fear.
Welcome to the Build Beyond podcast, where we challenge and guide so that you can meet your full potential.
I'm so confused about fat. And it's one of those things, since I'm not a dietitian, I avoid it. We focus on protein, we focus on carbs. I'll talk about anything to avoid a conversation.
Talking about fat.
And I look back at my youth, I think. I mean, I was born in 82. So I remember as a kid that margarine was good and butter was terrible. My dad had his first heart attack in his early 40s, which would have been like early 90s. And I know we've talked about my dad on previously dying of cancer, but before that, he had heart disease and he had some surgeries and different heart attacks. So at that point in the 90s, fat was bad. And even avocados we had to cut out. And I grew up in Southern California, so you can imagine that it affected what we ate at home.
Yeah.
And then over the years, my dad's fat intake changed, though, because fish oil is a fat, and it became the craze. And for a while, coconut oil was amazing. And now it's not so amazing, I guess. And, if you talk to the carnivore and keto crowd, you shouldn't really worry too much about LDL numbers. That's not a big deal. Butter's back in for some people. I mean, some people put it in their coffee.
I know.
So you've got, it gets so confusing. I mean, even when we're talking about, when I grew up, I remember canola oil being healthy. But now, if you talk about vegetable oils or seed oils to the wrong person, they're going to lecture you on some international conspiracy with Bill Gates and Satan trying to take over the food supply and poison us with these seed oils that are going to be they're the next plague. You know what I mean? So I have no idea even where to begin with fat. How do you even address fat, or how do you start this conversation?
In my role, I address fat often because I'm seeing people with cardiovascular disease and diabetes the majority of the time. And I do discuss it with my clients, students. I discuss it with all of them because it's a very important nutrient in our body. We need that to help digest and absorb fat-soluble vitamins. It cushions our organs. It keeps us warm, makes our skin soft, and it's actually a part of every cell. The thing people don't remember about fat is that it's a great source of energy, and it's energy that we can store that's readily available in times that we may not be eating. But it is confusing. Now, this really dates me. I graduated from my master's program in nutrition and dietetics in 87. And at that time, completely until the mid-90s, I did the same thing. Fat-free this, have margarine. If I saw someone with heart disease, they were not allowed to eat more than 2 eggs a week. It was all exactly what you said. Keep away from fat to help your heart. And even as a dietitian right now, the research is pretty confusing because there is very good evidence that show us saturated fats, which I'll talk about in a minute, truly do not cause an increase in cardiovascular disease. And there is also some pretty good research that shows us that it does. So to understand fat, you have to understand the different types. And saturated fat right now is the one that I think is the most confusing. Saturated fat can increase your LDL cholesterol, which still is a very important indicator of heart disease and cardiovascular risk. My LDL is high. I do everything correctly. However, my mom and dad's LDL is high, so it's a very hereditary thing. And saturated fat may have something to do with LDL if you eat large amounts. So what's saturated fat? It's any solid fat, any fat that's solid at room temperature, cheese, butter, the white gristle that you see on steak or in ground beef, bacon, sausage. All of those things have saturated fat in them. Are they all horrible for you? No. But if you have cardiovascular disease and you're eating 10-ounce high-fat steaks, or you're eating processed meat that has saturated fat, such as sausage and bacon every day, then that is going to increase your risk for cardiovascular disease. If you're having a hamburger once in a, even 2 to 3 times a week or smaller amounts of those types of saturated fats, it's going to be okay. And when we look at saturated fat, we look at dairy products as well. And most of the research that was done on saturated fat years ago focused on just the fat. It didn't look at the food as a whole. So when you look at ground beef, there's iron, niacin, B12, and protein. Yes, it has saturated fat, but you get all those other nutrients with it. When you look at dairy products, sure, there's some saturated fat, but you're getting protein and calcium and vitamin D. So I think it's important to know that we look at the food as a whole. So saturated fats truly are not the villain that we once thought they were. If I have a patient with cardiovascular risk, however, I would encourage them to make most of their fat unsaturated instead of saturated, but I would not tell them to avoid it. Does that make sense?
It does.
Does that explain sat? And I think that's one of the big ones we're hearing arguments about, as you said. Would I recommend margarine over butter? Not in a million years, even if you do have heart disease, just because butter's natural. And we know that we have to eat foods that are a little bit more natural, Mm-hmm. So it's confusing. So my general rule of thumb, and this is what all the researchers at the end of their papers say, eat, if you're going to lower your saturated fat, consume healthy fats, which we'll talk about in a minute.
Okay.
Any questions about that saturated fat?
I think it's a hot topic. So
it's a very hot topic.
Even with that explanation, I know of some people who are just going to adamantly disagree.
Yes.
Saturated fat in large quantities is not going to contribute to heart disease. And even if it raises your LDL, they will say that there is an association, but it is not a cause and effect.
Exactly.
And I know that there are some, I don't know, people have some qualms with the way the research has been done in the past.
Yes. Yeah.
And I understand that. And
I do too.
And I understand that we can't necessarily, if there's just an association, we can't really say cause or effect.
Right.
But there seems to be a very strong association. And it seems to be, when certain people, or a lot of people, when they take drugs that, like a statin, that directly affect LDL levels, that we have better outcomes. Yes. So it just seems like such a strong association. And I don't think anything we say today is going to cause anyone to change their mind on the subject.
And I have friends who I get into discussions with this. And I respect all of people's opinions and what they read, and that's fine, as long as they're eating healthy foods. And what I mean by that is you can't eat sausage and bacon and bologna and hot dogs as your form of saturated fat and say that it's not going to have any effect on your cardiovascular risk, or actually a risk for insulin resistance, because those are such heavily processed meats that have a lot of inflammatory properties in them. If they want to eat fresh, whole meat that they know where it was sourced from, or even if they bought it from the grocery store, and combine that with a lot of fiber and other nice whole foods, I can't argue with that. But I do have some people that discuss that with me in my clinic when I'm seeing patients, that they've read that saturated fat's okay, so they can eat 7 pieces of bacon and 2 pieces of sausage for breakfast every morning. And there are people that do that. But when you have heart disease, I think that is very dangerous.
I went down that path for a while. I remember talking to my dad, and he said that, in the 90s, when he had his first heart attack, they put him on statins.
Right.
But his cholesterol numbers were not abnormal.
Yes.
But they did it anyway. And I remember him being frustrated with it because he was one of the people who had some pretty severe muscle pain with statins.
Oh, did he?
Like debilitating. And so he was not a fan of the medication. He didn't understand why he had to take it. And I think I kind of got on, in my youth, got on that craze of, saturated fat probably isn't that bad. And I think I was also in this bad place mentally where I just thought heart disease for me was inevitable. It didn't really matter. Like, I might as well do what I want, because that was the way it had always been presented to me, that being hereditary was, I couldn't escape it. So I kind of had that idea of like, it's probably not that bad. I can do whatever I want. But I've completely changed that view. I mean, at this point, I take a low dose statin, and it is directly, I tried diet for a couple years, conscientiously, without completely cutting out meat and saturated fat. And it still didn't have a significant effect, which is probably the hereditary portion of it.
Yes, it is.
And then I ran a trial with my primary where I was on the lowest dose statin I could. I did it for a year, and we retested this year, and it was a significant change. So the conversation now in my 40s was, really the decision-making process was, do I want to be around long enough to know my grandkids? And if so, yes, I need to work
Absolutely.
working on the diet, but I don't have any side effects, luckily, from statins. Like, it doesn't feel, I don't feel anything.
Yeah.
So for me, there's only potential benefit. That's the way I see it. So I'm not afraid of saturated fat, but I am also I'm not downing bacon. You know what I mean? Like, I'm not going Atkins anytime soon. I'm not going to, I don't think keto, although I'm sure keto would help me. It could help me in some ways. Like, I'm sure I could strip body fat quickly with it, but I think playing the long game, for me and for a lot of people I talk to, when they start to really think about the mortality issue of it, saturated fat, it may not be the smoking gun and this like strict cause or effect, but we have to at least acknowledge it. Okay, so saturated fat, good, bad, maybe, highly diverse opinions. I think everyone can picture what a steak looks like. Let's talk about the confusing fats. So we've got monounsaturated, unsaturated fats. So you've got monounsaturated fats, you've got polyunsaturated fats, which, interestingly enough, I know the seed oils and vegetable oils they're supposedly at this point really bad. But I have seen research, and I've talked to people where, like, actually compared to saturated fat, the health outcomes are significantly better if you can transition over. So not necessarily as bad as everyone thinks they are, but I think super confusing. Monounsaturated, polyunsaturated, and then we can talk about other stuff. But I get really confused.
That is the base premise of using unsaturated fats in place of saturated fats are probably still going to help your cardiovascular risk. So one thing to note is that all products that contain fat have a little bit of all of those fats. When you look at oils, they're going to have a certain percentage of saturated, monounsaturated, and polyunsaturated. Monounsaturated fats are things like olive oil, avocado, the avocados your dad couldn't eat, nuts, peanut butter, seeds. These fats, we pretty much know, without a doubt, the evidence shows this helps reduce LDL cholesterol, and it also can increase our HDL cholesterol, which is that good cholesterol that we want nice and high to clean our arteries. The other thing about monounsaturated fats is they're anti-inflammatory, they're good for our guts. So I don't think there's a lot of question about whether we should include those in our diet. Those are a given. But it's when we come to these polyunsaturated fats, those also contain a little bit of the mono and a little bit of the saturated fat. they too can help lower LDL and increase HDL. Not quite as well as the monounsaturated fats. And these are our seed oils that we hear about. Corn, safflower, soy, grapeseed, all of these oils, I agree with you, are much better than using a lot of saturated fat. And I think the research has been misguided and misunderstood in a lot of these seed oils. Some of the things that I have heard and that I have read is that the processing of seed oils, the way they extract the oil from the seed, can produce this horrible substance, hexane, which can get into our bodies and cause inflammation. And when you look at evidence-based studies, very little of that actually gets into our body. And as they're processing these oils, sometimes they have to heat them a little bit. And so a lot of people have said that causes trans fats. So trans fats now are in our body. And again, the evidence shows very few amounts of trans fats actually get into that oil. And trans fat, which a whole other topic here, if anyone doesn't know, is a chemically made fat where they take oils like these seed oils and turn them into a solid. That's what's in margarine. That is what's in Crisco shortening. Remember, our grandparents used to use that. And there's no argument about trans fat. You shouldn't have any of it. It's just something that's just not good for us. So the other thing I hear about seed oils is that they produce a reaction when they enter our body. They're high in linoleic acid, and linoleic acid is converted in our body to arachidonic acid, which can lead to inflammation. But again, the evidence shows that it is not a large amount of that acid, and that acid in some ways can also decrease inflammation. So the talk I hear about seed oils is it's toxic because of the way they produce it and that it's inflammatory. When actually, if you look at good evidence, it is telling us that it's still helping lower that LDL and increasing the HDL better than saturated fat would. But it would not do that better than monounsaturated fat. And the other thing we have to remember is omega-3 fatty acids, which we know helps reduce inflammation, it helps heart disease. Those are polyunsaturated fats too. So omega-3s are found in canola oil, and they are found in small amounts in some of the other oils. So we kind of have to remember that as well.
Yeah, so I get confused between like the linoleic and the linolenic, because one's inflammatory and one you find in fish oil. I can never remember the two of them, but the terms get a little bit confusing. But is that where you think maybe something like fish oil could be very useful for people who, because perhaps there are people out there who can't change their nutrition as much as they'd like to. Like maybe they have to eat in the work environment and the food preparation is what it is. Maybe you travel or you're a truck driver or things like that. You just, maybe you don't have access. So is that where something, is that for someone like that? Is that when you would maybe recommend some type of fish oil supplementation?
I do, particularly if they have a history of cardiovascular disease or there's a history of it in the family. It's something I actually recommend to many people. Because omega-3s are in canola oil, fatty fish, as we know, which a lot of people don't like, walnuts and flax seeds, chia seeds. Yeah. That's about our only good sources, and it's hard to get enough if you don't eat fatty fish. So I will recommend fish oils, and I always caution people to look at the label to make sure they're getting all three of the omega-3 fatty acids. I can't think of the names of them now. ALA, DNH, and DPE, I believe. But
DHA and EPA
DHA like and ALA. You just have to make sure you're getting all three of those sources in there.
Okay.
And we can maybe even add in, we can put that into the notes. I can look up that information for you.
Yeah. The fish oil is interesting because I definitely I got on that craze for a while too. I had like a little pump thing with fish oil. Like, I'm talking about like when I make a choice to do something, I'm compulsive. So
I think you do. I'm learning that about you.
Yeah. So it was interesting because I started doing it And then I would like spontaneously go and get my blood work checked, which I was a big fan of at one point, and now I don't recommend that to people for a lot of different reasons, but partially because I got sold on a lot of supplements I didn't need based on like, I didn't have any signs or symptoms, but like my blood work showed certain things. But anyway, I had been taking fish oil, and then I got some blood work done, and my inflammation was crazy low, like really good. So I just assumed, oh, that's the fish oil. And then at some point I stopped taking fish oil for whatever reason, and then like completely stopped. And then sometime later, maybe 6 months, a year later, I tested, got a blood work done, and my inflammatory markers had not moved at all. So I was like, oh, so my diet and lifestyle, I just, and that's why I was taking it, because I was like, oh, I have a history of heart disease. It's a pro-inflammatory disease. I probably have systemic inflammation. I probably have it. And then the blood work was this false positive in a way, the saying that like, oh, the fish oil is doing something. And then I realized, after spending way too much money on it, that I really didn't need it. And I remember my dad this was when he had cancer. He didn't know it. His CRP levels were just through the roof, and he was bathing in fish oil and doing all the anti-inflammatory things he could. But obviously, no amount of fish oil is going to fix metastatic lung cancer. So and that's the problem with some of these lab tests. If they're done outside of the context of having like a conscientious healthcare provider look at the signs and symptoms, that a test like that is not, I think it's like, I can't remember if it's highly sensitive or highly specific, but you'll get a lot, like if you have high inflammation on a test like that, it doesn't tell you what's wrong. It just tells you have inflammation. It could be your diet, you could have cancer, like it could be a million different things. So people's reactions may be going out and spending thousands of dollars on fish oil, like I did, or someone might have cancer like my dad and be thinking that it's something that he could fix with diet. So I feel like that's part of the reason why looking at like just going and getting blood work done and not knowing how to look at the whole person and look at yourself, which is hard to do, not having a really conscientious, well-informed healthcare provider guide you all on that process. It can be expensive. It can lead you down a path that delays treatment for something that potentially could be really valuable. But I would say, as fairly anti-supplement as I am, I'm not super anti-fish oil, because I think the worst case scenario is you're wasting some money, but like there's so many potential health benefits. It's not like a supplement that doesn't do anything. And that's my pet peeve with a lot of supplements, is they literally have no effect. You might as well just like rub a crystal on your forehead. Like it doesn't do anything. But fish oil clearly, in my opinion, clearly does have an effect. I haven't seen any negative effects, but
I think so, especially if you are, maybe to the general population, if there's no cardiovascular risk in your family, you have no problems. Maybe not, but particularly if you do, or you have a history of it like you do, I do think it helps. And I've seen it help in patients I work with. I mean, I have people with diabetes that I've seen for 10, 20, a couple of them for 30 years. And I could see some of the things that they have done to bring their lipids and their heart disease risk down. And that's always been one of them. But like you said, is it that, or is it the fact that we're eating fiber, or that we're eating more whole foods, or that we're getting more fruits and vegetables? Who knows what's bringing that inflammation down, or keeping that disease at bay. But you're right, it is hard to look at those blood tests and isolate it to one particular substance. That is difficult.
And I don't want to name the specific company, but because I think there's a lot of them out there, but you can go pay them, and they'll give you a blood panel form, and you take it to Quest or whatever. They'll run the blood, and then they'll send it back to the company. And then part of the fee that you pay is to get on the phone with a doctor. It's a physician who's going to look at your blood work, but never did a physical exam or took a history, and essentially is just going to sell you on supplements. And fish oil is just an easy sell, which I guess it's not going to hurt anyone, but I think that's just maybe like a running theme in our discussions. I just have this healthy
supplements.
I have this healthy distaste for supplements and supplement companies, because the insidious thing is that people who are really pro supplement, one of the first things that comes out of their mouth is like big pharma is evil. Big pharma is all about money. And it's like, at least they're regulated, and if they pay someone off at this point, it has to actually be registered. Like you can look up to see which doctor's on a payroll. The supplement industry, it's over a 50% markup. There's only regulation. It seems like if something goes wrong on the back end, or if someone pays some third party tester, but there's no, it's the Wild West.
It is the Wild West.
Huge money. You have free license to make any claims you want, because essentially you're
unregulated.
You don't have to prove anything. You don't have to have research. It takes like 17 years to get a drug to market or something crazy like that. And I can start my own supplement. We could start our own supplement company after this call, and like we just not air this, and then people wouldn't know. And then
that's
we
what
can say
I always.
whatever. We can say whatever we want, because you can't disprove. And a lot of the supplements are proprietary. Like I don't know how they manage that, but you don't have to tell people specifically what's in it. And it's like, well, if there is a therapeutic effect, we would really want to know the quantity, because maybe the quantity is so low, like the dose is so low, that like we'd have to be an infant mouse to have any benefit from it.
Exactly. Shocking how many people are in supplements. Young people, students I work with, come in and I have them do an intake record for me, and they take a plethora of supplements. When I ask why, often the parents recommend them. They don't know. They heard it was good for them. And again, it's that social media advertising those supplements. And so many of the nutritionists on social media sell supplements. A lot of the exercise social media, they do as well. Yeah, so it's very common, and a lot of my patients take them too. Spend a lot of money on supplements that people don't have. They get taken in by that. So yeah.
Oddly enough, though, I did recommend fish oil supplement today, this morning.
Did you? Good.
I rarely do it, but I have a patient, and she's been working for about 6 months on a knee issue, and she's doing all the right things. She's making the progress. Actually had a former injury that was diagnosed with imaging, so there was damaged tissue. She's in a recovery process, and just not making the gains that she wants to. She's been working on her sleep and her nutrition and exercise and training for an event, and it hasn't. So I was like, might as well. I mean, maybe add some fish oil. Add some fish oil, and we recommend a protein supplement. Just bump it up a little bit and see if it gets her over the edge. But I think that there things like fish oil supplementation can be if we're not talking about like pathology, like heart pathology, or just your person with knee pain or joint pain, if you're doing all the right things, it can be a really nice way to augment what you're doing, because it could have a positive effect, and there aren't really any negative effects that I know of, and it's not super expensive, and you don't need a prescription. So, I'm in that with fish oil, and I'm in like that kind of in between stage where like I think it could be. But talking about fat, there's some people I'll be like, well, why don't you put ghee in your coffee or something like that? So I just think with fat, there's like, fat is one of those topics where it's divided, and people have like almost this religious grip on their belief. The vegans are very strong about one opinion, and the carnivore people are very strong about the other. And fish oil advocates are just confident that this is a huge factor, and that's why for me I just stay away from it, honestly. I talk about other things, and people want to get into fat, I refer them to you, or that's the way you go have a conversation with someone who deals with this every day.
So I think the most important thing is just to remember that we need fats. I usually recommend 25 to 30% of fat, because not only does fat add some taste and texture to your food, it provides satiety. We always talk about getting those meals that keep us nice and full, so that we're not snacking and eating in between meals. Helps keep your insulin level, your blood sugar level steady. And if you can just remember, there's a place for all types of fats. None of them are going to kill you, and a nice mix of saturated and unsaturated is probably the best. And to me, the worst kind of fats that you can get are those processed fats and processed meats. I think that's probably the most dangerous, and most of the research I've read is dangerous. And a lot of people that do try to take fat out of their diet will often replace it with carbohydrates or refined sugars. A lot of people will do that. They're lowering their fat intake, but they're going to have some white pasta with no protein on it or nothing on it that's going to sustain them. I see that quite a bit too.
One of the sneaky things about fat, though, is that because it's so calorically dense, there's
Very
so much energy in it, and it doesn't fill you up necessarily. So if you've got extra oils and foods, you'll be able to eat just as much, but the caloric density of your food goes way up. And so for people who are struggling with weight gain, and then if we're talking about inflammation and things like that, people might be like adding in more fat by taking this fish oil. So it's like that.
Yeah, and that's why it's important to have somebody like a dietitian or you. I think you've got a pretty good handle on nutrition to explain that to them. I had a client I had been working with on weight management for quite a while, and we talk about nuts and fats, but she read somewhere how great almonds were for her and how they would reduce inflammation and would help fill her up. And she started gaining weight, to make a long story short, and we could not figure out why until she told me how many almonds she was eating a day. And keep in mind, a handful has 200 calories in it. She literally was having 7 or 8 handfuls a day. She thought they were good for her. She thought they were helpful, didn't even look the calories up. So that is something to consider, as it's very calorically dense. But and that's something I do, is I teach people how much to use, how to flavor those vegetables that you're going to roast with just a teaspoon of oil, not just dumping that oil on that roasting pan of vegetables. But you do have to be careful with it. 25 to 30% of our diet, of our total caloric intake, can be fat, but you don't want to go much higher than that, because it is calorie dense, and foods that have a lot of fat are calorie dense. So it is something you need to consider and kind of figure out how to work that into your diet.
I wonder if that is maybe one of the big components of the obesity issue that we're dealing with, is that, if you eat processed foods, and not that the processing themselves is necessarily harmful, but processed foods tend to have extra fat snuck in there, and so it's calorically dense. So if that's your diet, you can't pull that fat out. Whereas if you're getting whole foods and putting something together, you can control.
That's absolutely part of the obesity epidemic, and there's been papers and studies to show that the majority of Americans eat fast food, which has a lot of extra fat in it. Eat these processed foods you're talking about. That again, we're not discounting processing, but Little Debbie's, something a lot of my patients eat, and chips. Those things have both that fat calories and then have that sugar as well, which really can be bad for obesity. But it's absolutely one of the reasons, is the high fat content. And again, a lot of those fats may not be the best fats for our body either, the fats that they're putting. And that's one of the other things about seed oils. I've had people say, well, I cut seed oils out and I feel totally better. But that person that told me that cut out all the processed food. So they weren't eating Oreo cookies anymore, and they weren't eating Lay's potato chips, because all of those things had seed oil. So they cut them out because of that, not realizing that, well, of course you feel better. You're cutting all of those things out. So just have to be careful with fat. But thanks for bringing that caloric density up. I wanted to talk about that today. People want to get healthy. They're not sure what to do, but they hear their friend tell them that she read on this or heard this guy on TV say that gluten's bad or seed oils are bad. So I think it's really hard for individuals to determine what they should do when they are given a condition or a diagnosis or have a family history, kind of like you. You did not want to go down that path your father did, and so you tried everything to kind of get you healthy. I think that happens for a lot of us, and we don't understand it.
The problem is that we have self-diagnosis, and we've never had such great access to information, and it's actually somewhat of a curse at this point because sometimes the first thing you see that pops up on YouTube or Instagram is not, a lot of times it's not because it's the best information. It's, the person who has got the most likes. They fit the algorithm the best. So you're not necessarily getting good information. You're just getting information. And if you click on that, then the algorithm gives you more of that same information. And it would make it seem as if, this is the totality of the information out there, because I just keep seeing all this stuff. And it's like, no, they're just trying to get your attention. That's the whole point of media and social media. So, for people who have made the mistake that I have made multiple times in my life, where you go down a rabbit hole without actually having someone help, it saves you a bunch of time and a bunch of money, honestly, to go see a specialist and say, I'm concerned. This is why I'm concerned. What can I do to either put my mind at ease or get on a treatment plan that's going to have a positive effect, have positive health outcomes? There are a lot of people out there like that. And I think,
there are.
In all the professions, and I think you can reach out to someone you trust who's not in that profession, and they should be able to direct you.
Exactly.
And let you know, like, these are some good options. These are if I had the same concern, this is who I would talk to. And I think that's maybe the problem, the curse of the internet, even though it's such a great thing. Because if you think back to like the 80s and 90s, if you had a question about something, where would you go? You'd have to go to a library and look up a medical journal. No one's going to do that. So you couldn't access the information. And now we're just, we're just
one click.
Yeah, it's just it's like a flood of information that's good, bad, indifferent. You have no idea who to trust, and unfortunately, you'll get people who have letters behind their name that, but also, like, they're not necessarily bad people, and we can't agree on anything. You know what I mean?
Right.
So maybe you're gonna see I know cardiologists who are hardcore vegans. And I know of cardiologists who are out there on the internet putting out stuff where you should be keto and carnivore.
Yes.
So how can that be? Like, how can we have one profession that has spent that much time in school and they cannot agree on fat and protein intake in relation to heart disease? And for me, as someone who's concerned about heart disease and cancer, I know you mentioned processed meats, something I'm conscious of, because I don't want cancer either. But and I know there's some associations there.
Yes.
Who's right? Like, who do we listen to? And I don't have an answer to that.
No.
I kind of listen to both sides, so I'm super interested in what the vegan cardiologists have to say, and I take that very seriously. I don't think I'll ever become a vegan unless I absolutely have to, but it makes a lot of sense. But I'm also not going to discount what a carnivore cardiologist would say, because I see the value in animal protein. That the truth has got to be somewhere in the middle, and it's going to be different for me than it is for you, because we're different people. So it's one of those things. I don't think there's a one size fits all.
I think they are trying to do more and more research to cover this, and I think the research is changing to, let's really look, is it really that bad for us to eat more animal meat proteins if we want to, and how is that going to affect disease? And every article I read recently says more studies need to be done in this area, because it's a controversy among the physicians too. Like you say, there isn't really one side.
The interesting thing about, when you think about like ancestral, and anyone was eating wild game before, go and get, if you're not going to go hunting, go buy elk meat and try and cook it without extra fat. It's so lean. Unless, and I know that people in ancestral diets would have eaten whatever body fat was on that animal as well, but there probably wasn't going to be a lot. If it's truly a free range animal, you're not going to get a lot of fat off of that, unless you're maybe an Inuit eating whale blubber. You know what I mean? But I've even read some stuff that when people reference those diets, they're like, our records of some of these diets only date back to about like when agriculture started. And so if you look at like pre-agricultural, that is like the bulk of human existence. So if we're going to say that like eating a high fat diet, maybe from animals that are in captivity, is ancestral, well, you would have to acknowledge that around that same time, at least from what we know now, that, you know, agriculture is ancestral in the same regard. But if we're going to look at people who like pre-agriculture, you know, I don't know that there was a lot of just like fatty steaks out there for them to sink their teeth into. Like it wasn't. And nuts and seeds were probably prized and sought after, but you weren't to get 7 handfuls of almonds. The amount of work that someone would have to go through to get to collect those wouldn't have been worth it. You know, they'd be out there scraping honey out of a tree before they're doing that, but that's pure sugar. So it's like trigger warning, you know what I mean? Like people, if they had access to honey back in the day, probably gorged on it.
For sure.
And it probably spiked their blood sugar and they didn't die from it. So I don't know, when we talk about, I think a lot of these assumptions on fat, especially the high fat diets, are made on a presumption of what we think might have happened with some particular ancestors that we don't have any record for, maybe at some point in time, and some, you know, for genetics that you may not have, but I may have. So I don't really know that, like, the whole idea of, I think we can eat fat, and obviously you can do keto. Everyone can do keto and probably not die.
Right.
And some people thrive on it. But I think it just speaks to the variability of the human body. Yeah, we can metabolize a lot of fat. But also I wonder, with a high fat diet, does it get boring? Is that why people lose so much weight? You know what I mean? Because at some point, like, how many fatty steaks can you eat? And you just like kind of like, I got enough, and you just kind of move on. It's, for example, like the potato diet. I've read a little bit about that, and people lost some weight on it, but potatoes get boring. You know, everything gets boring after a while. So and the interesting thing for me is still, there are fats that come from plant sources. So olive oil is one that I think is like kind of confusing still, because it seems like olive oil has health benefits, but maybe not with cooking. I feel like we've gone back and forth as a society on, is olive oil good or is it bad? What are your thoughts on that?
I think the overall research is that it is good. And the purest, the better. You know, the extra virgin. The thing you have to be careful with olive oil is the smoke point. You know, if you cook or fry with olive oil, the smoke point is very high, or very low. So a lot of the beneficial effects are ruined at that point. So you have to be careful with olive oil. It's best to use as salad dressings, or you could roast vegetables with it, but frying with it isn't really the best thing. But the amount of monounsaturated fats in that is so high and they've done a lot of research with just olive oil, showing the lower LDL. And then again, it goes back to that Mediterranean diet, which we have so much research on. The basis of that diet is using olive oil as really the primary source of fat in the fatty fish. They don't use butter in that diet. It's olive oil is your source of fat that you eat, other than nuts and fish. So that's the one area I personally don't see any conflict about. I haven't read a lot of research myself, that discounts the use of olive oil, except that you have to make sure it's a good one. You need to spend some money on olive oil. Extra virgin means it comes from not the first pressing that we would get, but the second pressing. I've had olive oil in Italy that was just pressed from the first pressing, and there is quite a difference in the taste and how you use that. But you have to be careful because there's a lot of olive oil blends, or if it just says olive oil, they often put water in that to make that a little bit less expensive. So I personally have no questions about olive oil. It's real. Plus, it has some anti-inflammatory properties, a little bit of omega-3s in it. So.
I've heard that it's big. It's like olive oil counterfeit. It's big business in Europe. They have that they actually regulate the export and the production of olive oil to make sure that if it's coming out of a certain region, that they're making it pure. Which I think it just makes me think of like the original mafia. The fact that that's still an issue is kind of
funny. I will tell you, if anyone goes to Trader Joe's, that oil is one of the best. Apparently, it comes from a very great source. I've read a lot of articles about that. The source of where that's coming from somebody in town talked to me about that, and it's true. So that one's pretty good.
I know of one that's I've actually been to the where they make it, the grove, the olive grove, Temecula olive oil from California.
Yeah.
It's expensive, but they don't use pesticides. They spray their olives with, it's like a mixture of water and clay, so that it has a really odd look to it. So they to keep the insects off, and then they have to like rinse them, and then they press it right there. And I've had it pressed. And what you said, it's peppery to a point where it's almost off-putting.
Yes.
Like if it's really fresh, it's spicy in a weird way. But pairs really well with certain foods, and that's what we were doing at that. We went there for like they had some kind of event where it was we had some food that paired well with it. Yeah, it was really good. Yeah. So if you're willing to spend some money, I really like Temecula olive oil, and they're not paying me to say this, but maybe they will once I'm going to tag them in this one.
There you go, tag it. Yes. I've never had that. I'll have to try that.
Yeah, they ship, and it's one of those things. We still buy it at home. I have it at home because we use it on salads and things like that. So if we're going to enjoy something, or like some really good pasta, and you want to put it in with the sauce, you will get depending on the season too, because they do different olives in different seasons. You will get it definitely changes the flavor of your food in a very good way. So if you're looking for good quality olive oil, you can get it here in the United States. Southern California happens to be a really good spot for some of that. It's just really good. The climate's really good.
Yeah, olives and wine.
True. Was there anything else about fat that we've missed?
I think any other. I hope I've explained it well. It's hard to explain it really well because it's so confusing. I think I've mentioned everything I wanted to.
Okay. Yeah. For most people, when they ask me, I'll say, you know what? Let's get your protein locked on, and I want to get fiber where we want it.
Yep.
When we do that, typically they've shifted to a lot more plant food.
Yeah.
Because we get a double whammy with the protein and the fiber.
Yeah.
And we typically have to make a significant shift at least away from processed foods. And not because I don't like processed foods, but just in order to get the protein and fiber, it tends to be more whole food sources. And that shift tends to decrease the processed oils that kind of sneak into foods. So the total caloric intake goes down. Yes. And then I don't even make a fat recommendation at that point. It's like, if you've got some fat on the meat you're eating, I don't care. You're not getting it. It's not sneaking in anywhere else. Yeah. And if you want to put some extra olive oil or something on, it doesn't bother me at all. And it's the similar thing with salt. I actually if you're eating a whole food diet, adding salt can be necessary because you don't get it anywhere else. You actually have to put that into your diet. Where people are eating processed foods, they they're getting way too much salt anyway, probably. So,
and I think that's a good way to handle it. And a healthy individual who has no risk of heart disease, that's typically what I would do too. I think that's a nice way because you do cut your fat out. But if I'm talking to someone with a risk of heart disease, then I'll start really discussing the different types of fat. But I think that's a great way for you to approach that because it does naturally lend itself to healthier fats. So that's good.
You get into those harder discussions when someone comes in and they've got back pain and a risk of heart disease and they want to talk about nutrition. Refer.
Yeah.
I give you a little info to get you started before on your way to that appointment. But you need to go talk to someone who can help because, as we've mentioned, that with my dad, didn't have particularly bad cholesterol numbers, still had a heart attack.
Exactly.
Probably wasn't the main issue for him at that time.
It wasn't.
But had he talked to anyone he talked to a lot of people at that time, they probably would have done the same thing as cardiologists did. It was just a knee-jerk reaction. Let's lower it even more, which I don't even know is necessarily the wrong thing to do. Probably wouldn't have had it been such an issue had he not had a problem with muscle pain from statins. But if you're on the fence and you don't know which direction to go, it can be really helpful to talk to someone who specializes in it or deals with it every day to be like, based on you, everything you've told me, everything we've talked about, everything I've seen in your physical exam, everything I've read from the referring whoever, and all your goals, everywhere you want to go, I think you should go that direction. And I think that's the missing piece for a lot of people is just how do I have too many choices. What do I do? Do I eat butter and steak? Or do I avoid all meat? Or should I just be a pescatarian? You know what I mean? Which direction do I go? And our seed oil is going to sneak into my house at night and strangle me. Because there's like this, there almost becomes this unhealthy obsession and fear with some of these things where it's like, maybe avoid it a little bit, but also don't be weird. If you're out with your friends once in a while and you have a cheeseburger, I don't know if it's really going to have that big of an effect.
It's hard for people to figure that out.
Okay. And then genetics. I think that's another big one where I heard an interesting saying, and it's that genetics loads the gun, but the environment pulls the trigger. And I'm sure that's oversimplified and not true in every case, but it's quite interesting, I think, to think about. It's like, well, the gun was preloaded for me. I don't have a choice about that, but I can affect, at least partially, the pulling of the trigger.
Absolutely.
Or at least I can do everything within my power to make sure that trigger doesn't get pulled. Which is super empowering. Whether it's 100% true or not, I don't know, but I like that idea.
I like that idea a lot too. That's what I try and teach all of my patients. My diabetes is probably the highest group of people I see, which when you have diabetes, lots of times it's hereditary, but now we know we can reverse that. So, that gun is loaded. They don't ever have to have that trigger pulled because we know if you can do certain things, there's a possibility that you can bring your blood sugar back to normal. You can prevent the heart disease that comes with that. So, heredity does give us what it does. But I think we know so much more now than we did when I started about how we can keep that trigger from being pulled. Absolutely. Yeah.
For diabetics, going high fat, like going strict keto, and not just keto lifestyle, but measuring ketones,
right,
going into ketosis. Have you seen that being beneficial for diabetics?
I have seen it beneficial for short periods of time. And there's actually research that shows us that for up to 6 months, that will bring your blood sugars down significantly. The mechanism of weight loss helps with that. But then what all the studies show and what I've seen, and I would say 90% of my patients who have done that, is after that 6 months, then things start increasing, weight comes back on, their blood sugars start rising again. Sometimes their lipid values will go back up after a while. A lot of it is because it may not be sustainable, just what we were talking about, getting tired of eating that. Now we're thinking a lot of it's because the inflammation, most of the food they may be eating, depending on how they do it, could be inflammatory. They may not be using good high, healthier fats. I've never seen a lot of success with it. There is a nurse practitioner that I've worked with before that she believed that truly was the way, and she had some great success, but nothing was sustainable. And I will say in my whole career, which is pretty long, and keto's been around for a long time, I've had 2 patients. One of them's a person with type 1 diabetes who is stuck with that method of eating and has actually done very, very well. It's been very, very difficult. She was able to have babies during that time, but it was very difficult. And she's stuck with that, and it's helped her. It really has. But I just don't meet a lot of people that can stick with that. And for some, it doesn't always turn out to be a good thing. And I would say, even with my people with diabetes, I would say 90% of them end up gaining that weight back because they begin eating carbohydrates and the body isn't digesting those carbohydrates as well. It appears, and it just leads to higher blood glucose and leads to more weight gain.
Interesting.
So, yeah.
I wonder if it... Oh, go ahead.
And again, a lot of the people I see haven't really done it exactly like the ketogenic is supposed to be done. I've helped 2 people. If someone comes and sits down in my office with new diabetes and says, I want to try this, I want to get this down, I'm going to work with them. But even those people who I was working with every week, making sure they were getting 70% fat, it still wasn't successful. Short term, it's great. And people feel that. And I get so excited for them, but I know what's going to come. And then, so usually they get back on medication or get back on more medication. So I personally haven't seen a lot of success with it in the long term.
Yeah. Well, that's something to note for the listeners that, there are keto-esque diets, and then there is like metabolically going into ketosis. They're not necessarily the same thing. So if you are thinking that that's going to benefit you, you really need to figure that out and see if you can actually get your body into ketosis. And there's ways you can test your ketones and different things. And that's why, I don't recommend the diet, but I don't discourage it. But when people are like really excited about it, I do highly recommend that they go talk to someone who knows how to do it. Because if you're going to do it, let's just do it right. Let's actually see. Maybe it has an effect. But then I wonder how many people who don't have success, to your point, are just not doing it right. You know what I mean? Because it is hard. I mean, it's like when people saying, I can't lose weight in a caloric deficit. You're not in a caloric deficit. Like you can't maintain weight in a caloric deficit. It's not possible. So if you think that you're in a caloric deficit and you are not losing weight, that should definitively tell you that you are not in one. And then we have to figure out, maybe it's the oil sneaking in or there's something going on. Math's not right. I mean, it's hard to do. But I wonder with things like ketosis where like you're either in it or you're not, it seems like. I don't know if there's an in-between stage, but I've never tried the diet. But there are ways to measure it. So I always would recommend for people who are in it or are thinking about it, like I would go talk to a registered dietitian or some type of healthcare provider who knows who can guide you.
It's not an easy, 70% fat is not an easy diet to follow. No. It's very, very difficult. I mean, you have to actually create things that have fat to fit into your meal plan. And even despite people doing it correctly, though, the research is showing that after 6 months, it's not feasible. But again, it's something else to study. I mean, it truly is. So
I wonder, though, for people because as a chiropractor, we always talk about like conservative care. I try and do the least intervention possible to get the greatest results. And time is on my side because I don't treat serious conditions. So I mean, people are in pain, they take it seriously, but like no one's going to die from low back pain. It's just not going to happen. But other things that are more serious, like diabetes, where you could die or lose a foot, heart disease, where I've heard that the most common symptom of your first heart attack is death, because most people don't survive it. So it's like, okay, well, do we want if the gun is loaded and we have the genetics and we have the signs and symptoms and we have the lifestyle, we have all these things, and we're in the right age demographic and maybe the right ethnicity, because some of that can play into it.
Absolutely.
Why would we be conservative? Why don't we take that 6 months and be as aggressive as possible to get that blood sugar where we want it? And I wonder then, within a larger plan, maybe like a 10-year plan for a diabetic patient, could you successfully use the ketogenic diet initially and just like, boom, most bang for your buck. Let's drop that.
Yeah. And
that blood sugar.
Those are the people I've typically worked with. I'm working with someone now that he said, will this help? And I said, it will. Let's try it. But then again, most people aren't being followed by someone that's going to help them. They just go on it and go off of it. Then you gradually reintroduce carbohydrates and gradually decrease the fats over another 6-month period. And then the body can adjust to that. So I didn't explain that well. So then it could be. And that is usually my goal. If someone walks in my door with a 500 blood sugar, they're not working because they feel bad, we'll cut their carbohydrates down low just for 2 to 3 weeks, even maybe. And sometimes just doing it for that long will just make that blood sugar go down quickly. And then you teach them how to get that nice mix we talk about with proteins, fats, and carbohydrates. So I agree with you. Sometimes that gets them started for 6 months, but that's the trick. Then you have to gradually work with some kind of provider that's going to help you gradually add some carbohydrates that have a lot of fiber back in and lower that fat down a little bit. Because that's the other problem with your lipid values all look good 6 months after being in a ketotic diet often too. But then the long-term effects of that, which is a long-term effect of diabetes and high blood sugar as well, and insulin resistance, is cardiovascular risk. So, but I've done that a million times with my patients. You bring their blood sugars down real quickly, then very slowly add back and change that diet again. But the problem is people start it, they follow it, and then they change completely. They go from high fat, hardly any carbs, to high carbs, hardly any fat. And then protein kind of gets washed away during that transition, I've noticed too. So it's interesting.
I like that concept.
I do think that's the best thing. I really do. If your blood sugars, that's what I would want to do. If I was diagnosed with diabetes, I would want to do everything I could to get that blood sugar down first and then figure out how I can keep it down.
And it just speaks to the value of someone like you for a long-term plan.
It does for dietitians and even I'm also a certified diabetes educator, and there are nurses that are certified diabetes educators that know as much about nutrition as I do. So any listeners out there, just seeing a certified diabetes educator is very, very helpful, because they can take the time to work with you to whatever goal you want to meet. And when you have diabetes, you have to work with what the patient can work with. I mean, that individual has, just like you said, everyone has their own needs. They have their own budget. They have their own life. You have to work on a plan that's going to help them the most.
So are you saying then, for someone who's diabetic, potentially eating nothing but bacon for 2 weeks?
No, I am not saying that.
They would lower blood sugar.
They would love that.
Yeah. I don't know. That's, I have seen, I remember someone talking a long time ago about going on Atkins, and they were like, yeah, it's great. I eat bacon and pork rinds. It's like, whoa, that doesn't, I mean, that fits within the diet. I don't know. It's like, it doesn't seem like it's that healthy.
Yeah, that's something that a lot of my patients with diabetes will walk into my house saying, well, I'm eating pork rinds now. It's like, all right, there's no carbohydrate in that. How much are you eating? And it's just funny. But it just comes back to the point that you said is we have to look at each person individually, and not all research is going to work for every person. You got to look at everything and look at that whole, what their lipids are like, what their heart's like, all that stuff. So
well, I can get on board with fad diets and supplements if it's part of a long-term plan.
Yeah.
If you've got something that's, hey, this is progressive and it's measurable, we're going to test and retest. And if we don't think this is having an effect, then we can change
it.
So,
and that would be great if everyone could see providers that were able to do that. If everyone had someone working with them. You and I have, when we work at the college, we both have the ability to do that more than maybe other people might. I can work with patients like you're saying to a certain point, but as far as being the ability to keep testing and retesting frequently with them, their insurance isn't going to pay for that. So I can't do that. They get a cholesterol once a year. They get their A1Cs every 3, maybe every 6 months. Testing blood sugars frequently is very expensive. Some insurance companies don't pay for continuous glucose monitoring. So it's really hard to see how things are working when they're limited to how many times they can see the doctor and how many testing they can have done based on their insurance. That's where it becomes difficult.
Yes. Yeah, I don't even want to go off on
we can't go in there. But even to see me, I mean, if you have diabetes and you're not on Medicare, you get to see a dietitian, I think, for 2 hours a year. And that's all their insurance will cover. Medicare does a great job with that, but other insurance companies don't.
Well, I will make a plug for the listeners then. If you are a resident of Michigan and physically located in Michigan, you can reach out to Denise, and she does take cash, and she's cheaper than a plumber at this point. So if you are frustrated with your insurance and you can afford a plumber, you can afford Denise. And it's definitely worth an email and a consultation to see if she can help you with things, because it's just one of those things. Like people spend more money on car payments willingly for, and cars are obviously necessary, but then they will for someone like you to help with something that could add not just lifespan, but health span. Maybe you only have a certain number of years left, but what do you want to do with those years? How active do you want to be? Like, do you want to be tied to a bed? Do you want to be missing a foot? It's obviously going to have an effect. So, we can, don't skimp on the plumbing if you got a clogged drain.
It's true.
Get that taken care of. But consider the cost of not taking action. And so, as I mentioned, I don't really deal with serious things, and we want to keep pain under control, but you're not going to die of your disc problem isn't going to kill you, but your diabetes might.
Yes.
The heart your cardiovascular disease might. There are a lot of things that are really, really serious. But man, diet and lifestyle changes over time. It's not going to be a quick fix, but we can do some aggressive stuff, and then we can make that long-term plan. It's just so valuable. What would that be worth? You know what I mean? If you find someone in their 70s who's maybe got another 10 years left, but they are tied to a chair or a wheelchair, if you could give them a time machine and they could go back and they could withdraw money, how much would they pay to be able to walk and move and be active for those years? And I think it'd be a lot. So I think that this stuff has value to it. And that's why I put such a big emphasis for pain patients on nutrition, because if I help you with your knee pain, but then you have a heart attack next week.
Yeah.
You know what I mean? Not that I can prevent heart attacks, but I mean, I can recognize that there's a problem. I take everyone's blood pressure. You know what I mean? Someone comes in with really high blood pressure, and you know, and I weigh them. I see their BMI. BMI doesn't tell you everything, but it's a number that we can compare. You know what I mean? So if we've got high blood pressure, high BMI, especially above 30, which is increasingly common, pulse isn't doing so great just with vitals alone. And then like, tell me about what you ate yesterday, and you kind of get this idea, and it's like, man, yeah, I'm really sympathetic about that elbow pain. You know, we get that tendon pain under control, but you know, have you thought about making these other changes?
And I think it's great that you include that. It's so important.
That's why I like putting these discussions out for my patients, because I will spend a ton of time on rehab. You know, I'm going to focus on that elbow or that knee or that back. Sometimes we maybe only have 5 minutes to talk about nutrition and they don't want to hear it. But ideally, maybe one of them will listen to one of these conversations.
Right. That's great.
Like, oh, that's it. Yeah, and I'm going to call Denise or someone like her. And so hopefully it helps. Well, anything else on fat before we wrap it up?
I think I've said everything.
Okay. I will post some stuff in the show notes for the listeners. Denise, I think, will send me some stuff. I've got some stuff too that I think is helpful that I'll put in there.
Okay.
And anyone can just reach out to either of us. I'll put our contact. I think our contact information is always in the show notes. But if it's not, you can reach out to me, and then I'll put you in touch with Denise. All right. Thanks, Denise.
Thanks. Thank you.